Welcome to Fertility Friendly Food, the podcast. My name is Stephanie Vlakis and I'm an expert certified fertility dietitian and nutritionist and founder of the Dietologist, a multiple award-winning virtual fertility and pregnancy nutrition clinic serving thousands from around the world, and of course, the host of this pod, Fertility Friendly Food. This podcast is dedicated to all things health and nutrition in the world of fertility, reproductive health, and pregnancy. Each week, I bring you practical snack-sized episodes to help improve your lifestyle on your trying to conceive journey, alongside guest expert interviews to help inspire you to learn and grow whilst you grow your family. Welcome back, everyone. Excited to be talking about male fertility today with our team senior dietitian and nutritionist, Candice Crellin APD. She sees a number of our clients here in our virtual clinic at the Dietologist, and she has a particular interest in male fertility alongside PCOS management before and during pregnancy, gestational diabetes, recurrent miscarriage, hyperemesis, and so much more. And I'm thrilled to have her back on the podcast again. It has been a little while to chat about this topic, which you have probably seen in the media quite a bit in recent years regarding male fertility, specifically sperm health and the quality and quantity rapidly plummeting, and that it is headed towards zero. Pretty astounding. I mean, could this really be the end of reproduction in just a few short decades? It's a pretty big claim. Now, I know most of our listeners and followers on Instagram at @the_dietologist, by the way, do identify as females, but I also know that many of you listen to these podcasts in the car with your male partner, or you send them on to your partner to listen. So I'm hoping you will do me a solid with this one and get it into literally any man's ear holes so this important conversation can reach men. And whether that is they're actively trying to conceive or not. I had a catch up recently with a bunch of friends from uni, and a couple of my male friends came up to me. I was like, I'm not interested in trying to conceive just yet, but I've been listening to your podcast and it's really made me think about some of the things that I've been doing, and I appreciate that. And so it's never too soon to start thinking about your fertility, whether you're female or male. So Candice, welcome back to the pod.
Hey, Steph. Thank you. Thanks for having me back. It's great to be here again.
It is. And so this season, as we all know, we are getting stuck into a community question each week. So we're going to kick it off with that. Don't forget, if you're tuning in, you can leave us a question anytime using the less than 30-second question form, which is always linked in the show notes for you, or you can send us a voice memo on Instagram. So today's question, I have low testosterone. I am a male. Is there anything I can do with my diet or lifestyle to improve my testosterone levels?
Yeah, that's a great question, Steph. And I think the evidence around this, obviously we need a lot more, and there's a lot more sort of research going on in this space. But there's certainly some indicators that diet and lifestyle do play a role in this area. One of the things I think in particular we know is that when males are carrying excess body fat, they tend to have lower testosterone levels. So potentially making lifestyle changes to assist with losing that body fat can help to restore some of those testosterone levels as well. So that's one of the things we can certainly have a look into if that's relevant to somebody. We also know that things like high alcohol intake can lower your testosterone levels. So certainly a quick review of things like your drinking habits may be warranted. And while not diet related, things such as chronic high stress levels can also be a bit of a risk factor for that too. From, I guess, a dietary patterns perspective, which is something we like to look at a lot with our clients, is some of the evidence is starting to suggest that sort of the pro-inflammatory dietary pattern, so thinking about things like eating lots of highly processed foods. So we're thinking about things that might be high in lots of added sugars or unhealthy fats and salts and those sorts of things, that they can potentially be impacting our testosterone levels as well. So from a diet perspective, we can look at replacing those pro-inflammatory foods with more of our anti-inflammatory foods. So thinking about eating a diet that's rich in fruits, vegetables, whole grains, lots of healthy fats like oily fish, olive oil, nuts, seeds, avocados. All those sorts of things can certainly help to bring your testosterone levels up as well. And certainly exercise is another thing that's really important too. So having a look at adding some exercise into your lifestyle if you're not doing so already, or doing a review of your physical activity if you need to. So there's certainly a lot of things that we can consider, and these are the sorts of things that we'd certainly look at when we're working with our male clients.
Amazing. So whoever submitted that question, there's your lovely answer. And I'm sure I'm going to be referring to this episode quite a lot, because increasingly I've been getting a number of DMs and emails from people about low testosterone and what can diet do for it. So glad we got that one on the record to send on. So thanks for that, Candice. Now let's get into today's episode about the alarming decline in male fertility. So Candice, let's chat a bit about sperm and male fertility, and let's kick off with a few statistics. So how common is male factor fertility?
Great question. So as we know, it's certainly on the rise. Male infertility is generally present in around 9 to 16% of men. When we're talking about couples who are experiencing fertility issues, the male factors on their own tend to account for about 20 to 30% of the fertility issues that a couple may be experiencing. So it's certainly fairly prevalent, and it does look like it is on the increase as well.
Yeah, so I think we'll get into this as the episode goes on, but just clinically, as somebody who's worked in fertility for, not as long as many others like doctors and so on, but I guess fertility dietetics hasn't been around for forever. Over the last 5 years, I'm noticing consistently, A, we're getting better at testing it more, but B, just the rate of suboptimal and poor quality sperm it's more common than not. I would say a lot of the times we're seeing sperm that is getting palmed off as fine, but when delving in a little deeper, perhaps it could be better. And I think there's probably this kind of subclinical level of poor sperm quality, kind of like subclinical thyroid dysfunction and so on. So anyway, I'm sure we'll get into more of that, but I wouldn't be surprised if that statistic continues to inflate as time goes on. So what are some of the major contributors to male factor fertility? Like what causes this decline?
Yeah, look, there's a huge list of things that are impacting on the male factor fertility. And so I guess if we start looking at things such as genetic factors, so things like Klinefelter syndrome and also chromosome defects may be present. There can be infections that can be a contributor to declining sperm quality. We know also, if we look at things like cancers, obviously testicular cancer affects that area directly, but we know that anyone who's having any radiation treatment that's focused around the pelvic or abdominal region, that can certainly impact on sperm cell growth and development as well. We can think about things like endocrine disorders such as diabetes. If that's not diagnosed properly or well managed, that could be playing a role too. Certainly issues with our thyroid might be a problem. General hormonal disturbances can contribute to that low testosterone as well. There's so many things. Certain medications might be affecting that too. So blood pressure medications can sometimes be related to some ejaculation problems. Things like anabolic steroid use also play a role. Chemotherapy treatments, some antibiotics. So the list certainly goes on. You can have blockages in the tubes that transport sperm as well. We can look at things like celiac disease that may not be diagnosed in the first place. So there's certainly lots of people with celiac disease that aren't aware that they've got it yet, and it's not until they get to their fertility journey and things aren't happening that we start to uncover some of those things. So even if you have celiac disease and it's not well treated with a gluten-free diet, that can play a role too. We look at things like industrial chemicals and heavy metal exposures playing a role. Certainly the overheating of the testicles can be a big issue too. So, even things like sitting on the couch with your laptop on your lap. That extra heat can cause a lot of problems. If males are doing lots of bike riding, those types of things have implications as well. And then we've got things like our untreated or mistreated undescended testes. So if that's not picked up well enough earlier in life, that can be a problem too. I guess that's a huge list of kind of medical type things. And then we've also got like our diet and our lifestyle factors that we have to consider as well. So drug and alcohol use and smoking can all impair function. We mentioned stress with the testosterone, so that certainly plays a role in this area too. Our weight is really important, and that includes being underweight as well as being overweight. So making sure that we're in that right balance. You know, we're not eating too little, we're not eating too much, and we're achieving that healthiest body weight for ourselves as well. And we can link that in with sort of a poor dietary intake, and that can come hand in hand with thinking about those pro-inflammatory dietary factors that we were talking about with the testosterone as well. That's all certainly really relevant too.
What a great summary. So, long story short, lots of things can impact male fertility, and we won't know which one is relevant to you until we do some testing. And I think certainly if you suspect that one or more of these things is part of your story, then seeing the relevant specialist and support person, because the thing about male fertility is, whilst a fertility specialist can help, an andrologist is the person that runs the sperm analysis and is kind of your male fertility kind of expert, so to speak, which there aren't that many of. And then you've got urologists who look at more the health of the structure of the testicles and so on. But then if you've got a thyroid dysfunction, or you've got diabetes, or you've got high blood pressure, or you've got celiac disease, all those different conditions are then managed by each of those specialties. So it can leave, I think, men a little misplaced when it comes to managing male fertility, and probably not as well looked after as they should be, which I think is something that as a whole we all need to kind of pull together and work on some more. But I think that was a great summary. I wanted to just touch on the testing parameters of male fertility, like I mentioned at the beginning. So typically for male fertility, how we assess it is usually a combination of blood work, a physical assessment. So usually a doctor should examine, make sure that the testicles are where they should be and so on, and also a semen analysis. So semen is the actual ejaculate. There's the seminal fluid and the sperm, and there's also another mixture of things in there as well. And that semen should be sent off to a specialist lab, you know, within hours of getting the test done, and it's got to be temperature controlled. Like ideally you want to be doing it at this facility, not at home and then driving it 30 minutes across the town to get it into the lab. And certainly in an ideal world, people should be giving their sperm analysis to a specific sperm analysis lab, not just like your any old pathology centre down the road. Now, the reason why I'm talking about this so much is there's a number of different metrics that get spat out of your semen analysis results. You've got total semen volume, so how much ejaculate is there. You've got sperm concentration, so how much sperm there is per milliliter of the semen. You've got motility, which is the movement of the sperm, and typically that's then broken down into progressive motility, which means forward movement because you need it to move forward towards the egg. Then you've got non-progressive motility, right, which is they're moving but not necessarily forward. They're to the side or to the back or whatever. And then you've also got morphology. Now, morphology refers to the shape of the sperm. So what does the head, the mid piece, and the tail look like? And you might think, oh, all sperm kind of looks the same. Well, yeah, on the nice graphic designs on Canva it does, but in real life, a lot of sperm have two heads, two tails, you know, all sorts of funky, weird shape changes. Now, what I found fascinating was recently I attended a conference and they gave us this table from 2010, and I talked about it a little while ago on my Instagram stories, but I wanted to highlight it again. And it talked about how we should probably be viewing male fertility testing in centiles instead of the way that is currently being done is if you're over this number, you're fine. Like if you're greater than 4% morphology, everything's fine, or 3% morphology or whatever it is now. And that's how the WHO, who have set kind of the guidelines for semen analysis globally, have come out. But I find it particularly interesting looking at this centile table from 2010, mind you, 13 years ago. So we probably have declined since then again, because we're seeing a decline decade on decade. But I thought this was fascinating. Let's just take morphology, for example. Right now, the WHO says anything 4% and above, you're normal. 4% is a very low number when you start multiplying it by how many of those normal shapes are also moving forward. How many of those normal shapes are, in the right kind of environment? Are there enough of those normal shapes to get to where they need to be? So the number dwindles very quickly. So I just thought this was fascinating. So in 2010, the 2.5th centile, which means you're in the bottom 2.5% of the population, the morphology was 3%. The bottom 5% of the population is 4%. The 50th centile, which means 50% of the population would be under and 50% of the population would be over, in this study was 15%. And your top centiles of 95th centile, which means only 5% of people in the population are better than you, are 44% morphology. And then the very top centile, 97.5%, is 48%. So basically what I'm trying to say is somebody who's got a morphology of 4% is being classified as fine, just as someone with a morphology of 15 or 20% is, which is pretty wild to me. So I guess my qualm is a lot of males are getting lulled into a false sense of security that everything is fine when they go and do their semen analysis, and you should, when really we should be proactively working on male fertility, irrespective of something. If something comes back and we need to work on it, we need to absolutely pursue it. But if you're getting morphologies in the single digits, in my opinion, I think we should also be paying attention to that too and trying to get it up if we possibly can, because I think that will make a significant difference to your chances of conception. Anyway, that was a bit of a statistical testing rant. Sorry, Candice. But I thought it was interesting to note.
It certainly is, Steph, and you're spot on. The statistics are, they're pretty alarming, and if we continue to count that as normal and we're seeing people are having issues and delays to conception in that lower end of the normal range, then it's something we need to be addressing, that's for sure.
Yeah, absolutely. So I don't mean to be an alarmist about it, but I think we don't have the appropriate amount of concern at the moment. So I'm okay with being a little bit alarmist about it. So when should people be thinking about male fertility and preconception health? Like, when's the best time? Somebody listening, maybe we'll try for a baby later this year, or I'm not ready for a baby for 5 years. I remember when I was dating a lot, guys be like, it's okay. I don't want a kid for 5-10 years. Doesn't matter. I'll just drink and smoke and doesn't matter, right? Tell us, what's the time frame that people should be thinking about?
Well, look, I guess we start with sort of where we would say our absolute minimum would be. And so definitely 3 to 6 months prior to when you're planning to try to conceive, you absolutely must be thinking about this at an absolute minimum. But, we would always say 12 months is really nice, especially if you have any underlying health issues that you may need to address, or any lifestyle issues that you may need to factor in that you need to make some behavior changes around. So if we can get 12 months with somebody, then we can usually set them up for some really good outcomes and make some overall improvements, not just to obviously their fertility health, but their general health as well, which I think is really important to do. So we know for men, it's that 74-day window to generate sperm from start to finish. So we need that 74 days to be really spot on and ideal if we can. And it's hard for people to just make changes and say, all right, we're 74 days out, let's go. We want to have some lead-in time to make sure that we're able to maintain those changes over the long term as well.
Yeah, I think particularly, and this is a very broad generalization, but just the differences of working with males versus females is males feel like that they can flick the switch a lot easier, whereas I think females feel like they need a lot of warm-up time. But if there are a lot of changes to be made, as much time as possible, and some data that I've read, things like omega-3s, which I'm sure we'll talk about, supplementation, for example, there's not much benefit at 3 months of supplementing, but at 6 months supplementing, there seems to be a significant benefit. So it's probably a similar situation of, if you're a bit on the back foot, you may need 3 months just to get up to a good level. And then the next batch of sperm are going to benefit from that improved level, if that makes sense. So you kind of need a little bit longer than what a lot of people think. So tell us a little bit more about these statistics, Candice, the ones that are in the media showing that, sperm quality is falling off a cliff, it's declining. Tell us a bit more about the statistics. Is it just media being media, or is there some scientific merit to it all?
Yeah, look, I guess there's definitely some scientific merit. We've had a few meta-analyses that have come out, and these are basically like a summary of all the studies where they gather it up and pull the data together. So it's like a big sample. And these studies are done across multiple countries as well. And so what they've identified is that over the last 50 years, we've seen sperm count and concentration decline by a little over 50%. Okay, so it's a pretty big drop over 50 years to see that come down that much. And it appears that decline's happened a little bit more sharply in recent times. And so I guess some of the scientists out there are saying that, it's not a big deal, but I certainly think we need to be considering it as something that's really impacting it as well. We think that these thresholds could continue to increase over time. And so if we don't bring sort of some awareness and interventions into this space, this number could continue to decline over the coming years. And that's really where we're going to see some problems arise, especially in the area of fertility and preconception health.
Yeah, absolutely. I think we need to be paying attention to it. I think the sperm to zero conversation is, I think, probably a little bit alarmist. I'm not sure if we'll ever get there. I think it's an important possibility to entertain the idea of, but I don't know if we will get there because either scientists will intervene before that, because that would just basically mean the population would stop growing, which I think in some countries they're like, I was talking to a good friend of mine who lives in China, and she was saying they're pushing for people to have more babies. They want more babies. There's not enough population growth. It's causing problems in the society. But whether that's a fertility issue, possibly people delaying their conception, career, age-related fertility, or social, the one-child policy for so long, and now that's been so ingrained that they, financial, economic. I mean, there's so many different reasons why people do and don't have children. But if it's a medical reason and it can be linked back to declining male fertility, I think we will see government and other organisations investing a lot more resources and money into it. Whether it's in time, I don't know, to kind of save the day. But I think it's a really interesting topic because it has a lot of consequences outside of just fertility, like you and your partner making a baby. Like there's a lot of social kind of repercussions that we need to think about within society. So what's the theory behind why this is occurring? Perhaps you can give us a little snapshot. Obviously, nobody knows exactly why, but I guess people want to know, why 100 years ago was sperm fine, but now maybe not so much?
Yeah, I guess one of the big players that is sort of in the research at the moment is our exposure to environmental chemicals and toxins being a big one. And I think we can really focus some of our interventions on our exposures to those endocrine disrupting chemicals and the impact that they may be having too. And that's across female and male fertility. And I know we've got a podcast episode a little way back that talks just about these endocrine disrupting chemicals. So definitely tune back into that one for a bit more information on some of the simple things you can do to start to reduce your exposures to those. But we also know that there's those lifestyle factors that we certainly think is playing a role as well. Our increase in the processed foods eaten, our reductions in physical activities as a population on the whole, our changes in our weight status is something that's certainly in the research saying that it's looking to be part of the bigger picture as well. And the other thing I think, obviously, that a lot of media has come up about over the last couple of years is the potential impact of COVID on fertility health for males and females. And I guess it's really hard to prove causality and say sort of this causes that, but there appears to be some sort of link between having COVID and it having an effect on sperm parameters. And we don't know. This could just be something that's short-lived. I think we don't have the long-term research yet because it hasn't been around long enough to say. So I think we certainly need a bit more research into the why this is happening. But our focus certainly is looking at sort of those lifestyle and environment things as playing a big role, because that's a lot of what has changed about how we're living over the last 50-odd years.
Yeah, absolutely. I can speak just anecdotally from working with clients throughout the pandemic, and particularly it doesn't just apply to COVID as well. Like, I think it's important for people to know that, yes, it's relevant to COVID, but it's relevant to any illness, viral, bacterial, doesn't matter, that spikes your temperature significantly. So something that gives you a fever, that increases your body temperature, that can then, yes, even a small couple of degrees Celsius increase can impact negatively the sperm that lives in the testicles, because testicles hang away from the body to keep the sperm slightly cooler than the rest of the body. So if your whole body temperature rises and that rises, you can get that effect. Now, there could be other mechanisms at play with COVID, but just generally speaking, whenever I look at a sperm analysis, I always ask, have you been sick? Have you had COVID recently? All these kinds of things. Some clinics, I've noticed over the last few years, they've implemented their own protocols with IVF, for example, and they're quarantining the patients away from IVF for a period of 6 weeks or 3 months if it's a male factor-related element, and then they're retesting everybody, particularly for sperm analysis, and then going, yep, looks like things have recovered, good to go now for IVF or IUI or ovulation induction, whatever. So there is acknowledgement from, the fertility world that it may have a role to play. And so particularly if you're spending $10,000 sometimes or more on IVF, sometimes time is of the essence and the time factor will be bigger than anything else. But sometimes, a short delay is probably a better play and to maximize that quality. And in that 3 months, guess what? You can come work with us. We can boost things for you. You can use your diet, your lifestyle, all those kinds of things, so that when you do get to that 3-month checkpoint, you can hit the ground running as much as possible. So I've helped several of the couples that I work with in that particular scenario. So yeah, do reach out if that's relevant to you. Now, I guess, what's your opinion, Candice? What do you think is the situation when it comes to male fertility? What's your hunch?
Yeah, look, I feel like I always say it depends a lot. And, it's part of what we do when we're assessing someone is to look at all these different things that we're talking about today and see which of the things might be the most relevant to them that's impacting their particular situation as well. So, I certainly can't look past the impact of diet and lifestyle and the way our diets have shifted. We know people aren't meeting their fruit and veg recommendations. We know general diet quality is certainly not where it needs to be. And as that continues to decline, certainly the decline in fertility health has gone along for the ride with it too. So while it's certainly not cause and effect, I think that plays a big role, and it's really what our focus is on here. And we see some really good outcomes from helping people make those lifestyle changes.
Absolutely, absolutely. It is incredible. Like, it never ceases, even though I know mentally, logically, if I do XYZ with this client, we're going to see an improvement in sperm health. But then when you do the before and after testing, you look at it, you're like, dang, that was impressive. Like, you feel so good about yourself. You're like, wow. So, yeah, take it from us. Like, some of the improvements you can get can be absolutely huge. Now, I think some exceptions to that, and probably some of the most, I guess, clinically challenging cases that we have is if there's a structural issue like a variceal or a blockage or something like that, undescended testicle, you may improve the sperm, but you may not see it in the result because you've got a physical block to then run the semen analysis. And then additionally, with the other side of the coin is that you can, and some fertility treatments are, to perform a micro-tessie procedure where they actually go in directly into the testicle and aspirate the sperm out rather than letting it go through the tubes. And the other case that I was going to say is probably things like Klinefelters and things like cancer treatments. You may get some improvement, but you're probably not going to get, what you would get if somebody has exclusively lifestyle-related factors or metabolic health-related factors or celiac disease. Once you manage all those things, you should get like pretty much a normalization of the sperm. But in those cases, you're probably not going to get 100%, but you couldn't get enough of an improvement that the embryologist has something better to work with, which is sometimes what we're gunning for in those types of scenarios. So just wanted to acknowledge that, like, it's not going to be 0 to hero for absolutely everybody, of course. Candice, what can males do to proactively protect their sperm health?
Yes, I think there's a number of things, Steph, which is really good news for a lot of people. And just, implementing some of these changes does make a really big result. I think a starting point is doing a bit of a review of someone's diet and having a look at what they're eating and making a conscious effort with people to reduce their intake of highly processed foods if they're eating a lot of those. But then looking at things like, what can we eat more of? And so we want to focus a lot on those anti-inflammatory eating principles just to help remove any of those sort of nasty free radicals that may be causing additional damage to the sperm itself. So we look at things like certainly making sure people are hitting their fruit and vegetable targets. We look at things like omega-3, and so that is certainly a combination of diet and potentially supplementation for a lot of people as well. Using extra virgin olive oil in our cooking, using lots of herbs and spices as well for their antioxidant benefits. And then I guess there's a few sort of specific foods that we know can be beneficial. So having men include like a handful of walnuts per day, the research shows that there's some benefit to that. Also throwing a Brazil nut per day in for some selenium. Things like eating tomato-rich dishes because they have a high content of lycopene, which is linked to our sperm health. Including foods that are rich in zinc. So that's things like our meat, chicken, fish, eggs, legumes. And so if we're looking at sort of some of those key nutrients and enriching the diet with those foods that are high in those particular nutrients, it certainly looks to have some benefit overall. So it's really looking at a whole dietary pattern for a lot of people and, working with them to see, well, which bits are relevant to you and, starting to make some of those changes. And then I guess the other thing that we have talked a little bit about is reducing that endocrine disrupting chemical exposure as part of that as well. Looking at things like what you might be doing, that if you're doing anything that might be overheating the testicles. So if you're using saunas or bike riding a lot and those sorts of things, we might need to make some changes to those routines as well. And then, of course, for anyone that is looking to conceive, preconception supplement plan for males is definitely beneficial too. So I guess the preconception supplement world has been very, very female-focused for a long time, but we're certainly seeing a few more come out now with the male focus, which is great.
Absolutely. And I also counsel people when it comes to male fertility and supplements in particular, like all the lifestyle stuff's at play. Often I get the question, oh, look, we're just going to start trying. We haven't done any semen analysis as yet because at the moment it's not part of the guidelines to proactively check sperm, although I hope that changes. It's really pressing, I will even use that word, to get 12 months into trying to conceive, going to the fertility specialist, running a semen analysis and finding out the sperm quality is poor because there was so much that could have been done a year ago to potentially help you with that. So it's really saddening when that happens. So whilst that's not happening at the moment in terms of the proactive, what I would then suggest is that you consider what can you be doing proactively to participate, which we just talked about, the lifestyle piece, but whether the preconception multi is in or out or not. It's a good question. I always think if there is little harm, good safety, and also I think it's about participatory, like you're participating in the creation of your child together. You and your partner are on the same team together. Like all these things, I think sometimes can be just as valuable, if not as more valuable, as taking the supplement itself. In cases where there is a known sperm issue, we take a very different approach where we won't just give you just a preconception multi and call it a day. Like we'll get down a little bit more nitty gritty than that. But if you're just looking for optimization, it would be consideration. Now, of course, all supplements come at a financial cost. Got to weigh it up medically and so on. So don't just go out and buy whatever's on the shelf and give it a crack. You can book in with us if you're doing express prenatal supplement consult. You can request a recommendation for your partner. But I would just say, like, everyone's going to be different. So what you need and what might be relevant to each of you is going to be different, just like we talk about with female prenatal vitamins, Candice, we often hear from our female clients that their male partner is sometimes a little reluctant to make lifestyle changes. Not all the time, I will say. I don't want to, hate on our male listeners. I know you're listening. You're here. You're proactive. You're listening to this podcast. I'm proud of you. But FYI, sometimes we do see people who are doing the most and perhaps their male partner isn't along for the ride, maybe because they've been told their semen analysis is fine, so they don't sense this strong sense of responsibility to participate a lot, or maybe they're delaying, I'll just change it, the month before IVF or the month before we start trying, or the 74 days before I'll pay attention to it. What's your advice? Because I guess, yes, we're going to give them some science, but I guess this is kind of where the counselling element comes in as fertility dietitians, is sometimes we've got to navigate non-clinical conversations too.
Yeah, I think we spend a lot of time doing the counselling side of things with people, because making behaviour change is hard. Like, I would say a lot of people have a pretty rough idea of what to do, but actually doing it is the challenging part. So it's really a big part of what we do is helping people actually work out how to implement the changes and how to make them stick, because most people, when they're highly motivated, can make changes for a couple of days or a week, but then when it gets hard, that's when people will fall off the wagon. So that's really a big part. But I think it's really interesting looking at the male side of things. I think we're lucky that we do have a number of males that attend our clinic to see us, and they take a really proactive role in their role in terms of the fertility, health and preconception planning. But yeah, we do see those ones that just don't think it's their problem, unfortunately. And I think we need to make sure that men are educated that it's 50% their DNA going into this as well. And if they're not making those appropriate lifestyle choices to have the healthiest DNA they possibly can, then, it's going to have an impact on the health of their bub too. So it's really important for men to take some initiative and to be really supportive. I think there's nothing nicer than seeing a couple that are making changes and working through it together, and it's part of that team approach. And it really sets you up on that journey to parenthood, which is a team approach as well. So if you can get on board and do things together, I think it's really going to strengthen your relationship and your bond, and it's certainly worthwhile making those changes. So, if you've got any men out there that aren't too sure about why it's important for them, they can always jump in on a consult, and we have a number of them do that as well. And it's always great to have a chat and make people understand why their role is important, because it really is a big part of it too.
Absolutely, absolutely. We adore people who bring their partners, male, female, non-binary, doesn't matter. We really appreciate it because I think sometimes when you're in a consultation, like especially our 2-hour intensive consults, like 2 hours, a lot of information is being digested, shared, a lot. And like we send you comprehensive notes and your whiteboards and all this stuff and e-guides and all this material to your email to digest afterwards. But sometimes having a second pair of ears, it's not so they can tattle on you like dibby-dobby in, oh no, she actually eats chocolate every night after, or like on each other. Like sometimes you see it, they throw each other under the bus. You're like, no. That's not the point of the couples consult, everybody. It's not to throw each other under the bus. The point is really to then be on the same page, to know, especially if your partner is the one that cooks and shops and does all the meal stuff, they're the one that's going to change your diet and lifestyle dominantly. You can relay that information, but sometimes better to come from us. And the other thing I will say, if you do have a partner that perhaps is a little reluctant to come to the party with as much enthusiasm as you, then my suggestion would be that you outsource those conversations to somebody else. Don't let it come from you, because guess what? Even if you are me, fertility dietitian, expertise in this area, if I turned around and said to my partner, actually, you should be doing A, B, C, D, E, F, G, trust me, I don't think they would listen to me, even though I know a lot. They will want to hear it from their GP, their fertility specialist, somebody else. So like, give that burden to us so that you don't have to be the one that be like, see, I told you so, because then fertility is hard enough on a relationship. You don't need nagging and all this kind of other stuff to come into it. I know it sounds relationship counseling, but trust me, seen it all before. It's important. So outsource it to somebody else. Don't say anything. Just book the appointment. Honey, would love for you to come to this appointment, even just to listen. They don't have to participate. If they don't want to, they can just sit there the whole time. Doesn't matter. But trust me, some of it will go in via osmosis, even if we don't even have a 100% direct conversation with them. So anyway, that's my rant on that. Where do people get more help if they want to investigate their fertility further as a male, or just get more resources, information?
Yeah, so I think your first port of call should always be a check-in with your GP and get them to arrange any medical checkups you may require or any testing that you might need. And if you're going into sort of preconception planning and you don't have a GP yet, it's definitely worth finding one. I think that's really important. I think a lot of people these days just kind of see whoever's available, but if you're moving into the family planning space, you really want someone who knows you and can trust you and support you through that journey, regardless of whether you have fertility issues or not. You want someone that can support you as a family through pregnancy and then with the new bub as well, of course. So, of course, that doctor, your GP, can refer you on to a specialist if it's needed. So that could be a fertility specialist or it could be a urologist, just depending on what the issues are as well. So definitely all your medical check-ins should be organised that way. If you're looking just for a little bit more information, there is a website. If you Google the Healthy Male Project, it does have some great information and resources on there too. So certainly worth a look if you're after some more info there. And of course, we definitely feel like an assessment of your diet and lifestyle is warranted. And so somebody like us can certainly help along that way. We have lots of couples that come to see us. We have lots of males that come to see us on their own these days as well too. So just because we're fertility focused, we certainly see a whole range of people. There's no real limit to what we can do in that space. So I think making sure you've got a good support team medically as well as your lifestyle side of things is really important.
What a beautiful summary, Candice. Thank you. Now, we do have a previous episode way back in season 1 about what to eat and how to look after sperm as well. So I'll link that in the show notes for you all. There's a couple of blog posts as well, which I'll leave linked for you. We have our Nutrition for Male Fertility e-guide, which is like $19 or something ridiculously cheap, available on the website as well. It's really just, I really try and make the male fertility resources short, sharp, really effective, just so that, especially if you're handing it over to your partner, they've got enough information to take on board. And if they want more information, they can read and listen to podcasts and do more. Absolutely. But I do find men and women do learn quite differently. Again, it's a really broad generalization, but I do find that the one-page checklist and things like that is really, really helpful because you can print it out, stick it on the fridge and know what you're working towards. What I think is as well important to remember is that male fertility should be considered way earlier in the piece than that 6 to 12 months of inability to conceive, like I mentioned before. I think we need to be more proactive about screening of sperm. It's non-invasive. I think about how many internal ultrasounds, young females are having in their, I had internal ultrasounds as young as 19, I can recall. People in their adolescent years and in their 20s having, much more invasive, uncomfortable tests than a sperm analysis, although totally can be awkward and uncomfortable in other ways, but it's not physically painful or uncomfortable. So I think it should become routine. I wish it was Medicare funded or more recognized by the government so people could just walk in and say, me and my partner are going to start trying to conceive in the next 3 to 6 months. Can I just get my sperm checked, please? I want that just to be available to people so that we're not having these delays and then needing more and more intervention because at 12 months, you've wanted a baby 12 months ago. You want to be pregnant 12 months ago. So yeah, of course, you're going to go straight to whatever fertility treatment you can get to. But I just wonder how much could be done. And thinking one step before that, like we talked about ages ago in a preconception health episode, we need to be talking about fertility at a lot younger age. I know it seems inappropriate to be talking about fertility health with adolescents, but I think most adolescents are much smarter than what we give them credit for. And a lot of them might want to become a parent one day and they might actually care about this stuff. And even if they don't care about it right now, even just planting those seeds can help them. And so I think just talking about lifestyle and fertility health and all these things in schools properly and not just fear-mongering sex education, I think that would just completely change the game. Anyway, my point is conception is a team sport. Do the things, eat well, take your vitamins if you're meant to be taking them. Don't drink alcohol and smoke or do drugs. Very important. Keep your balls cool. Wear boxers, not briefs. Don't cycle to work for 6 hours a day, please. Okay, got a client case study about that one. But the evidence is continuing to mount that not only is the sperm important when it comes to conception, 50% of the DNA, but there is more and more evidence starting to mount that the health of a father before the child is even conceived or born is going to influence the epigenetic expression of your future child's health. So you have equal responsibility when it comes to preconception health, not just mum. Anyway, I'm going to leave it there. I can get on my high horse about this topic quite a lot, can't I? So thank you, everyone, for tuning into this episode. Thanks, Candice, for joining us. Don't forget to follow on your favourite podcast streaming platform. Whatever you're currently listening on, hit follow, please. And don't forget to leave us a 5-star rating on Apple Podcasts and Spotify. It makes such a difference to our little podcast to grow, reach more people. And don't forget, this one is worth sharing. Please share it with someone who would find it useful too. And until next time, everyone, bye. Fertility Friendly Food, the podcast, acknowledges the traditional owners of country throughout Australia and recognises the continuing connections to lands, waters and community. We pay our respects to First Nation cultures and to the elders past, present and emerging, and extend that respect to all First Nations people tuning in today. This podcast is recorded on the land of the Gadigal people of the Eora Nation.